is Janet Darling. I'm a nurse practitioner. Welcome to my innovative video proposal about chronic diseases. In this proposal, I will be discussing how the Nutrition Menu app can help to manage chronic diseases. In a moment, with his written permission, I will be using my next patient to assist me with this presentation. Let's talk about the problem of chronic diseases. Chronic disease is an illness lasting more than 3 months. It cannot be cured by medication, nor can it be prevented by vaccines. 8% of Americans over 65 are diagnosed with at least one chronic condition, the cause of 7 out of 10 deaths. 86% of the nation's healthcare costs are spent on treating chronic diseases. We talk about chronic diseases such as diabetes, high blood pressure, heart disease, and obesity, and these are the most costly and they are preventable. Half of all American adults have at least one chronic condition. 1 out of 3 have multiple chronic conditions. In 2012, a whopping $17 billion was spent on chronic diseases, $61 billion on direct medical costs, and $56 billion on direct care costs. Now we'll talk about risk factors of chronic diseases. There are many risk factors, such as hypertension, exposure to secondhand smoking, physical inactivity, low fiber diet high in saturated fats, tobacco use, excessive alcohol use, obesity, high cholesterol, and unhealthy lifestyle. So who's affected by chronic diseases? Well, it affects anyone, anywhere, anytime. It affects children, adolescents, male, female, any ethnic group, any religion, or anyone with one or more risk factors. So where does the problem of chronic disease occur? Well, it is a worldwide problem. Chronic diseases such as diabetes, stroke, COPD, cancer are the leading cause of mortality in the world. It represents 60% of all deaths in the worldwide, and out of 36 million who died in 2005, half are under the age of 70 and the other half are women. So let me give you a little background on Mr. Hernandez before he comes back. So Mr. Hernandez is a 25-year-old male patient who is morbidly obese, has high blood pressure and diabetes. He's non-compliant with his medications and exercise, and he hasn't seen a doctor in about 3 or 4 months. Hey, Mr. Hernandez. I'm Miss Darling. I'll be a nurse practitioner. How are you doing?
I'm fine.
So what brought you in today?
My car.
No, Mr. Hernandez. I mean, what made you come in to see me today?
My wife.
Is she the one being seen?
No, doctor, he's the patient. He has high blood pressure, diabetes, and he is overweight. He hasn't been to the doctor in about 6 months.
Oh.
So the reason I haven't been to the doctor in 6 months was because the doctor called me some type of beast.
Oh, no, you mean, she meant because you're obese. That means your body mass index is greater than 30. That's all it means. I'm sorry for the misunderstanding.
Doctor, he doesn't take his medication, he doesn't follow the diet, and he doesn't exercise. And I mean, when we go out, he says that counting calories is too much. Just overall, everything is just too much to keep up with.
You know what? I have the perfect app for you that will help you. This app will track all of your activities, your diet, your exercise. When you go to the restaurant, it will calculate your meal planning. As a matter of fact, I can show it to you. Are you interested for me to show you the app?
Sure.
So, Mr. Hernandez, it's called the Nutrition Menu app, and it costs $1.99, and you could download it to your iPhone.
Why isn't it free?
Well, with an app like this, for $1.99, it's worth every penny. Believe me. So if you notice here on the screen, it has all the menu from all different restaurants. Click of a button, it calculates all the calories and all the nutrients. So as we continue our discussion, we want to talk about how the app is going to address the problem of chronic diseases. This app will help the patient to track activities of daily living. And non-compliance is a major problem with patients with this type of illness. And so the app will count all the food nutrients in grams such as carbohydrates, sodium, fats, sugars, and dietary fibers, protein, cholesterol, saturated fat, calciums, and it will also do a caloric calculation. The app comes preloaded with restaurant menu items and calculate all nutrients and calories with a touch of a button. The app accommodate all diets, whether you're counting calories or you're counting Weight Watchers points. At the gym, the app tracks your progress, counts your heart rate, and how long you have been working out. Okay, so I would like to demonstrate how the nutrition menu app works. First of all, let's go to the restaurant feature. If you want to go to a restaurant to eat out, you the screen comes up and you can pick, maybe say you want to go to Applebee's and you would like to have, say, chicken with sides. You click on that, and then you want to have a chicken tender platter. You click on that, and you see where it tells you how many calories and all the food nutrients that are involved with this meal. Also, if you want to, say, add your favorite food, you could go ahead and enter that. Say, I already have eggs in there, and it shows you that the egg has 70 calories, it has 5 grams of fat, and so on and so forth. So then I want to go to exercise, and say I want to do aerobics exercise, low impact for 30 minutes on February 28th, and it shows that I burned 229 calories in 30 minutes doing aerobics. So, and I click add, and it will go right to my diary. So then I want to look at the journal feature, and the journal feature kind of shows you everything that you do for that day. It shows you every calorie you took, all the exercise you've done, and it also add all the calories and all the sugars and everything that you did for that day. So then I want to go to the weight feature, and you see how I have February 28th, I was 202 pounds, and then February 26th, I was 203, so I lost a pound a day. And then you just click add a day if you want to continue to add your weight in there. So then we can quickly go to the settings, and we see where we have settings. You could adjust any setting you want to adjust, and we could do a backup restore, and then there's a user guide to tell you about how the app works. And that's basically how the menu app works. The app is innovative because it is a new method of monitoring daily activities. It is economical and it satisfies the need to achieve a goal. Also, because it delivers the applied information. Monitoring progress has a major effect on goal attainment when results are physically recorded. To alleviate the problems of chronic diseases, we could improve compliance by regularly exercising at least 3 times per week, follow a healthy diet, keep all care providers' appointments, take medications as prescribed, and maintain a healthy weight. According to the CDC, decreasing the risk of developing chronic diseases has been approached from the individual and population level, which healthcare interventions. The population level could include an environment that promotes healthcare. The CDC recommends utilizing 4 factors, which are epidemiology and surveillance, environmental approach, healthcare system intervention, and community program linked to services. The reason for failed attempts at controlling chronic diseases in the past. Noncompliance is the greatest factor for failure of controlling chronic diseases. Also, insufficient healthcare follow-up and insufficient community preventative programs. What would be different if the problem of chronic diseases was solved? Patients and their families would be relieved from early death. They would also be relieved from disability. People would experience greater quality of life, and the money spent treating chronic diseases could go towards poverty, education, and housing for the poor. And also, productivity at work would be increased. People I chose to collaborate with me during the project. I chose my primary care physician, Dr. Brown, a discharge planner, Miss Veronica, and the bariatric care provider, Miss Tessie. All three interviewees were chosen because they regularly utilize evidence to guide their practice. All three interviewees work with the special care population and could extensively adopt the use of the nutrition menu app. They possess knowledge of chronic diseases and how it affects their patient population. Each interviewee provides follow-up care, which require the patient to keep a list of diet consumed, exercise completed, and medications taken. Medicine, the American Journal of Public Research, and I did use those journals to complete my project. Miss Veronica suggested using Sinhal plus full text and the Cochrane Library for my database search. Miss Veronica also suggested emphasizing the restaurant feature on the menu app. I did find a lot of good information on the two databases, and I did emphasize the restaurant feature on the nutrition menu app. Miss Tessie suggested using the WellDoc, Diabetes Manager, and mHealth as far as reference points to doing the innovative project. She suggested using the Adobe After Effects to edit my presentation. I only use the mHealth as a research engine since I already have most of my information, and I did use the Adobe After Effects to edit the presentation and found it useful. The social impact of having chronic disease. The stigma attached to dealing with chronic diseases affect the patient negatively in aspects, such as embarrassment from having a disease, which could result in delay in diagnosis and seeking treatment interventions. Also, keeping the diagnosis secret from friends and family, and maybe because those closest to you can be the strongest critics. The ethical impact on chronic diseases. Ethic is an intellectual approach to moral issues, philosophical framework for which to critically evaluate the choices and actions people take to deal with various aspects of daily living. Healthcare providers have an ethical obligation to treat patients with benevolence, which means promote health, non-maleficence, do not do harm, and not autonomy, respect freedom of individuals to control their own life, justice, to treat everyone fairly, fidelity, to keep promise real and implied, and velocity, truth telling.